Tonight we continue our series of pre-election interviews by revisiting ballot question number 2. If the referendum is approved, voters would make it legal for patients in Massachusetts, with the assistance of physicians, to end their lives by taking a lethal dose of medication. Some call that death with dignity, while others call it physician-assisted suicide. Joining us again is our guest, is one of the opponents calling for a no vote. We'd like to welcome the chair of the Committee Against Physician-Assisted Suicide, Rosanne Meade. Thank you very much for being with us, Rosanne.
Thanks for having me, Chris.
Rosanne, start with some of the worst case scenarios that we all think of, even if we don't like to talk about it very much. Somebody has a really serious health problem. They feel that this could be near the end, and the worry is, what if this means being in pain or at least great discomfort?
Well, I think that one of the problems is that we all fear death, and we all fear pain with death. And so this ballot question plays on our greatest fears. And every doctor that I've spoken to has talked to me about the fact that if at the prognosis, if when we were beginning to say to people, you have less than 6 months to live, the first thing we did was hook people up with palliative care and hospice. It would remove many of those fears. Palliative care would be able to talk to you about pain medication and how to take it and how to make sure that you were not in discomfort, how to alleviate other symptoms too, nausea and the kind of discomfort that comes with some of the pain medication. Palliative care is able to handle all of that. And if you were hooked up with hospice at the same time, then you would find that you and your family would be alleviated from many of your fears. We find that most people, it isn't pain that causes them to reach for the option of suicide. It's the fear of being a burden or the fear of not being able to live their life the way they want to. And hospice is there to take care of that. They say, we'll help you live every day until you die. And so if we spent more energy and time trying to hook people up with palliative care and hospice, doctors feel as if many of their fears would be alleviated.
You had this experience in your family. What was the turning point that sent you in that direction?
My mother, 5 years ago now, was very ill. She was elderly, 93, and she had osteoporosis, and so essentially her spine was crumbling, and she was in pain. They tried several surgical options and then turned to palliative care. It was in a day there was a difference. She was able to communicate with her children and her grandchildren, and she was not uncomfortable again. And so that's when I first became really interested in this. And then recently I've had the experience with my sister-in-law. She was given less than 3 months to live 18 months ago. And she is making plans to go to Florida for Thanksgiving. She's, and I think one of the things that happened with her is she did get hooked up with hospice immediately. And they were able to give her a tour, tell her what her options were. She could be at home, she could be in their facility. And I think it removed a great deal of her fear. So those are my experiences.
Now, this might be a very good option, but how available is this to people? Because I know that going back some years at least, getting palliative care was not all that easy.
But it's more and more available. And that's one of the things that we are hoping will be a positive result of this ballot question campaign, is that every time I go and I speak to people about palliative care. And I know that every hospital recently has been educating their physicians, all their physicians, on what palliative care is available and how to access it.
The way the referendum is worded, there are some kinds of safeguards that are built in, and I know you distrust them, so why is that?
Well, there's no requirement for counseling. There's no requirement for a physician to actually be there when you take the medication. Up to 100 Seconal tablets, you undo them and put them in water, and we all know medication is not always as reliable as they would like us to think. But there's no requirement for a physician or a nurse or anybody to be there when you take the medication. There's no requirement for counseling, either at the time that you get the prescription or when you take the prescription. So we think that the safeguards that they say are there are not reliable. I think this is a very dangerous ballot question. Whether or not you are in favor of physician-assisted suicide, I'm really hoping that people will listen to the education ads and also will read the bill themselves so that they can see what it would be like. I mean, there's no physician-assisted suicide. It's physician-prescribed suicide. When one would have to ask themselves why every major medical organization is opposed to this ballot question.
I imagine a lot would hinge on whether somebody makes a decision being asked only if they want to end their life voluntarily or if they have other options at the same time.
Well, that's what we're hoping, that there is a requirement for notification, but no requirement for counseling by palliative care and hospice. So we're hoping that, that people will reject this ballot question and that we will begin a campaign to really make sure that people know more about hospice, not just when they're diagnosed with a terminal illness, but now, while we all can make choices and think about it in a more positive way. This ballot question plays on all our greatest fear, and I think we would be better served by looking at the more positive aspects of life and really looking to vote no on question 2 and increase information and education about hospice and palliative care.
What about the ability of safeguards in this referendum to cover the possibility that the patient might be psychologically impaired, if only because they're depressed about how ill they are?
Our research tells us that up to 40% of people, when they receive this kind of diagnosis, become clinically depressed. And I mean, everybody would be sad and hopeless, but clinically depressed means you could be helped by psychological counseling and medication. And one should not take people at the time that they're the most vulnerable at a time like this and not have them have to have some kind of counseling by either a psychiatric counselor or pastoral counseling or by hospice and palliative care, who I think really would be able to alleviate the kind of fear that we all have.
Right now, it looks to be maybe another close election. What do you hear out there?
Well, the polls are tightening in our favor, and we're very encouraged, not satisfied. I think the education is working. The more we talk to people, my experience is when I say to people that I'm chairing the committee against it, people say to me, oh, I think I'm for that. But when I talk to them about the flaws that we see, I've been able to change all but one person's mind.
All right. Well, thank you very much for being with us again.
Thank you very much for having me, Chris.
Rosanne Meade from the Committee Against Physician-Assisted Suicide.